Hi, my name is Ethan Barton. I'm going to be performing a administration of medication checkoff today. Uh, I'm a student nurse at the University of South Alabama. Here's my ID card. I do not have scrubs today because of the bookstore's availability of them, so I am instead dressed professionally. Also, I'd like to point out that I have COVID, so if speaking is loud or I have to cough during the middle of my checkoff, I apologize. I'll be trying to avoid that. Then also, I'm going to scan the room with my computer. Okay. And now I'm going to get my patient care order form and my MAR, and I'm going to compare the um, medication to the on the MAR to the patient care order form. So it's heparin and heparin. Here it is right here, and then also 5,000 units, and that matches up. So 5,000 units here, 5,000 units here. I'm going to turn the camera down so you can see that better. 5,000 units here, 5,000 units here, and then next I'm going to make sure that I have the right patient, which is Jaguar Jones, right here. Make sure I have the right amount, 5,000 units, 5,000 units. Make sure I have the correct route, which is subcutaneously, and then the right time, which is every 12 hours. And then I see here every 12 hours as well on my MAR and my patient care order form. I'd also like to point out during this time that this will be I'll be using the no interruption zone policy, which means that I will make sure that my colleagues or anyone else around me will not be bothering me during this time so I can focus on what I'm doing. Next, I'm going to verify the patient allergies on the chart. I see on the MAR it's penicillin, and on the patient care order form it is also penicillin. And then I'm going to perform hand hygiene. Next, I'm going to select my medication, which is heparin. See right here, heparin. And then I'm going to inspect the medication expiration date, which is 12/5/2020. You can see the expiration right here. Expiration is 12/5/2020. Also going to verify that I have the right patient, which is Jaguar Jones. Make sure I'm administering this medication at the right time, which is every 12 hours, which is at the right time right now, which is 7 o'clock. I'll make sure I have the proper route, which is with heparin. It is a subcutaneous injection, and I'm using my tuberculin syringe, 1 milliliter tuberculin syringe. You see right here. And also make sure I have the correct amount, which is 5,000 units of heparin. And I have already calculated that with this vial of heparin, it being supplied as 10,000 milliliters, 10,000 units per milliliter, excuse me, that I would need to inject 0.5 milliliters to inject 5,000 units into the patient. So next, I'm going to clean the top of the vial with my fresh alcohol swab. And then I'm going to obtain my syringe. And then I'm going to remove my cap. I'm going to withdraw air first from my syringe. Stick it into my vial. And then I'm going to turn that upside down. Push air into my vial, which you can see that. And then pull down my syringe to make sure that I fill it up past 0.5 milliliters. And then I would thump my syringe to make sure I get all large bubbles out. Then I'm going to inject back into the vial until I get to my correct dosage, which is 0.5 milliliters. Then I'm going to set my vial back down and pull my syringe out. And then I'm going to, using the scoop method, I'm going to move my camera first so you can see. Using the scoop method, I will pick up the cap of my syringe, and then I will carefully cap it to ensure safety. that I get no needle sticks. And then I will show this to the camera. So it is, see if you can see that, 0.5 milliliters. And then I'm going to recheck with my MAR to make sure this is the correct amount. So 0.5 milliliters at 5,000 units. And it's 5,000 units for 0.5 milliliters. After I've done that, I would usually verbalize talking to another nurse, and I would ask another colleague or another nurse to make sure I have the right calculations for this medication, and then also the right dosage and the correct medication in that case. The next, I'm going to compare the MAR with the 5 rights again. So this is my second check for accuracy. So I'm checking for the right patient, Jaguar Jones, correct. I have the correct date of birth, which is 8/25/1963. I have the correct medication, which is heparin, as I have just injected, drawn up into my syringe, at 7 o'clock, which is the 12 hours past the last time it was injected. Subcutaneously, I inject heparin, and I'm using the correct syringe for that, which is a tuberculin syringe, as already shown. And I also have the correct dosage, which is 5,000 units, or 0.5 milliliters, and that matches up with my MAR. It all does. Now I'm going to have a prepared label for my syringe. So I'm going to, on my label it says Jaguar Jones, 0.5 milliliters of heparin. So I have the patient's name, the dosage, and the medication. And I will put that on my syringe, careful not to touch the barrel. And then I will get me a piece of tape right here and then tape that up. All right, I have that taped up. Okay, now I'm going to move with my medication, my prepared syringe label, and my MAR to my patient. So I'm going to move the camera over here to my patient, Mr. Jaguar Jones, with my MAR and my medication. I'm going to turn the camera again to make sure you can see my workspace, and I'm going to perform hand hygiene before I verify the patient with 2 different identifiers. I see that this is Jaguar Jones, and I see here's my patient's armband. It says Jaguar Jones. I compare the date of birth, which is 8/25/1963, and the date of birth, which is 8/25/1963. I'd also assess the patient for any allergies with my MAR and the armband. So I see the patient is allergic to penicillin on my MAR. The armband also states that they are allergic to penicillin. And I would ask just Jaguar Jones, sir, are you, do you have any other allergies I need to be aware of? And he says no. So that is good. So this means that it's safe to administer this heparin to you without having to worry about allergies for you. And I would also, at this time, perform pre-administration assessments, such as checking for blood pressure or checking for the pulse, anything that I need to do before administering my medication. So now I'm going to verify again the 5 rights for medication with my MAR, and I see I have the correct patient, Jaguar Jones. This is the correct patient. I see that I have the correct medication, which is heparin, the correct dosage, which is 5,000 units and 0.5 milliliters. I see it is the right time, which is 7 o'clock, which is 12 hours since the last time this medication was given. And I also have the one second please. I have the right patient. I have the right dosage. I have the right medication, which is heparin. I have the right route, which is subcutaneous. And then I also have the right dosage, which is 5,000 units. And the right time is, I'm sorry, I'm going to start over one more time. So I'm going to verify that I have the correct patient, which is Jaguar Jones. I have the right medication, which is heparin. I have the right dosage, which is 5,000 units and 0.5 milliliters. I have the right time, which is at 7 o'clock every 12 hours, and also have the right route, which is a subcutaneous route for heparin. Okay, next, I'm going to explain the procedure to Mr. Jaguar Jones. Sir, today I'm going to be performing a I'm going to be administering medication today that is heparin, and you're just going to feel a little stick in your abdominal area. Now I'm going to raise the bed to working height, and then I would lower the side rail, and now I would apply clean gloves and goggles. I'm going to adjust the camera slightly. And then apply my goggles. Now I'm going to make sure I choose the correct injection site, which is for a subcutaneous shot of heparin. I'm going to be using the abdominal area, which is the 2 inches from the umbilicus, forming a U shape on the abdomen. And so once I found the correct injection site on my patient, I'm going to clean the injection site with my clean, fresh alcohol swab, clean in a circular motion. Once I've done that, I'm going to remove the cap of my syringe. Then I'm going to pinch my skin, I'm going to pinch the patient's skin, and I'm going to stick in the needle and slowly administer the medicine. And then I'm going to draw out the needle and then dispose in my sharps container. Here's my sharps container. It's labeled. And I'm going to dispose my cap in there as well. Now I'm going to make sure the patient is in a comfortable position. Mr. Jybor Jones, are you in a comfortable position? Excellent, so he is. And I'm going to raise the side rail back up and lower the bed down to its lowest position. And then I'm going to remove my gloves. I'm going to remove my gloves, glove to glove, and then skin to skin. Downwards towards the trash can, and then also remove my safety goggles. Then I'm going to observe the patient for any allergic reaction that they might have. I would also state that I would document the procedure on the MAR, and I would be documenting the patient's response to this, and this is the 6th right for documentation. So now I'm going to demonstrate on myself some injection sites. So first you have the deltoid injection site, which you can find this by going 3 fingers down from the acromion process in the most lateral part of the shoulder. So once you're there, you have to also make sure that you're not on top of the insertion of the deltoid muscle into the humerus. Basically, you go 3 fingers down from that acromion process. Then right here, you have this line. It's hard to do this one hand, I apologize. But I would form a triangle with that point. And then right here in the middle is where I would inject my medication. This is an IM shot. So you would inject this at 90 degrees by spreading the skin. And then also the dorsolateral injection is found midway down the arm, and I find this by going, here we go, 3 fingers up from the olecranon process, and then 3 fingers below the insertion of the deltoid muscle. So 3, boom, it'd be right here. So this is a subcutaneous shot. So I would do this by pinching the skin. If I can get 2 inches, that I insert at 90 degrees. If I could not get 2 inches of the skin, then I would insert at a 45-degree angle. This would be like any subcutaneous shot that I might give. And the next I'm going to show the intradermal the intradermal injection site. And by finding this, I would get 4 fingers from the elbow, from the antecubital fossa, and then I would go 4 fingers from the wrist, and I'm trying to get what you can see right here. So 4 fingers from the wrist, 4 fingers from the antecubital fossa, and right around in here, I would go in at a 15-degree angle, and I would get just under the dermis, and I'm looking for that bubble to pop up as I am injecting under the dermis, the intradermal injection. And then next, I'm going to talk about the ventrogluteal injection. So this is the IM injection. This is found by finding the greater. I'm going to move the camera down just a little bit. So I'm going to go to the greater trochanter of the. Actually, I'm sorry, I forgot real quick. I'm going to be using my patient to demonstrate this. So I would position the patient on their side, find the greater trochanter by moving the patient's leg, and I would place the heel of my hand on the greater trochanter. My right hand, place my thumb pointing towards his pubic area and my index finger pointing towards the iliac spine, and then my middle finger going towards the iliac crest. And this would create a V. This is hard to do on a stuffed bear, but you would see this is create a V around that area where I would look for muscle. So once I find that muscle, I would wipe my injection area clean with a alcohol swab, as I would all of my injection sites. By the way, I would wipe them all clean with the alcohol swab before proceeding. So I wipe clean my injection site, and then I would leave the alcohol swab pointing at the injection site, and then spread the skin apart. And on all my IM injections, I would make sure I aspirate first, and then I would administer my medication. So next I'm talking about the another sub-Q injection, which is on the abdomen. I'm going to lift my shirt for this one. So I would draw a U around my abdomen, 2 inches from the umbilicus, and I would make sure that I am not above the intercostal margin. Also make sure that I'm not below the pubical area, and also make sure I'm not beyond the anterior superior iliac spine on either side. I would pinch up 2 inches of skin, if I could, on the abdomen and insert at a 90-degree angle. And if I could not, then I would insert at a 45-degree angle into the skin while pinching the skin after I have cleaned the injection site. Next, I am going to talk about, on my patient right here, the vastus lateralis injection. So this is going to be found on the lateral side of the thigh. I would go a handbreadth from the trochanter, finding it as I did before moving the patient's leg. So I would go from the ventrogluteal a handbreadth, and also up from the knee a handbreadth to find that sweet spot in the middle third of that area, a little rectangle. And this is a subcutaneous or IM injection. And once I found that area, if it is an IM injection, I would spread the skin after cleaning the area and inject at a 90-degree angle. Or if it was a subcutaneous injection, I would squeeze the skin together and inject at 90 degrees if I could get, I would inject at 90 degrees if I could get 2 inches in between my fingers, or 45 degrees if I could not get 2 inches after cleaning the injection site. And that concludes my administration of medication checkoff.